Looking for a professional near you? Just head to the Gray Institute homepage, tap Locate a Professional at the top, enter your zip code, and find a certified provider in seconds.
Have you ever felt that dull ache in your lower back after a long day of sitting? Or maybe it just tightens up when you lift something, even with good form. Low back pain is incredibly common, and it often feels like it comes out of nowhere. But here's something most people don't realize: low back pain is rarely just about the back. It's usually a signal that something in your body's movement system isn't working the way it should. Here's one simple movement pattern to help reduce stress on your lower back. Alternating your feet, go ahead and lunge in 6 different directions. Go ahead and lunge forward. Go ahead and lunge backward. Lunge to the same side. Lunge to the opposite side. And then lunge rotationally in the same direction. And then lunge rotationally in the opposite direction. This movement pattern helps your feet, your hips, your spine move together instead of forcing your low back to move alone. If this feels stiff or awkward, it could mean your low back is compensating for limitations elsewhere. Low back pain isn't just from heavy lifting or bad posture. It's often a result of how your body moves or doesn't move. At Gray Institute, we approach low back pain as a chain reaction, a movement issue that usually begins somewhere else. Here are some of the most common root causes. Number 1, limited hip mobility. If your hips can't flex and extend, ab and adduct, internally and externally rotate well, your lower back picks up the slack, and that overload leads to pain. Number 2, poor thoracic spine motion. When the mid-back doesn't move in all 3 planes of motion properly, the lumbar spine tries to do more than it's designed to. And number 3, lack of triplanar strength and control. Real life happens in 3 dimensions. If all parts of your body aren't trained to stabilize in all 3 planes, your low back will likely pay the price. When your back hurts, it affects everything: how you sit, stand, walk, lift, breathe, and even how you interact with others. And if you only treat the pain, not the movement dysfunction, it keeps coming back. That's why understanding chain reaction is so important. Gray Institute trained professionals look beyond the site of pain and uncover the source, the movement restrictions, imbalances, or compensations that started it all. Whether you're a therapist, a trainer, or an everyday mover, this lens changes how you treat, train, and move. If you're dealing with recurring low back pain or trying to get ahead of it, take a step back and ask the right questions. Are you being assessed in an integrated fashion, especially by including hip and thoracic spine motion in all 3 planes? Are you building strength with functional loading patterns that prepare you for all aspects of life? Are you being treated and trained by a movement professional that is certified in applied functional science? Because your back is just the messenger. The real answers lie in the way the whole body moves together.